Hi, I'm Adil Fattar and welcome to this series of videos. These videos are part of your consent process, which includes the consultation with me, the written information I gave you in the clinic, and the letters in the post. These videos are generic and an aide-de-memoire, so feel free to watch them as many times as you like, jot down any questions you have, and I'll go through them with you in the clinic at our next appointment. If you're not one of my patients, these videos do not constitute independent medical advice and shouldn't really be used outside of the context of a consultation with me. Either way, I hope you find these videos interesting and informative. What does the liposuction procedure involve? Liposuction is generally a general anaesthetic day case procedure or used as part of a body contouring procedure. When you wake up, you'll be wearing a garment around the area. This is a snug-fitting outfit to give you comfort and reduce the risk of fluid accumulating under the skin where the fat has been removed. Before you leave the hospital, your garment will be checked to make sure it's not causing any digging in or creasing of the skin, and you'll be told to shower each day removing the garment to check for these problems. After the surgery, you'll have bruising and tenderness to the area. This is quite normal and nothing to be worried about. Most of it resolves in the first few weeks. You may feel slight irregularities under the skin. These are also quite normal and again will resolve over the next few weeks. The area will be numb. This will resolve over a period of weeks to months. Sometimes there could be permanent patches of numbness that remain. You may notice some asymmetries between the two sides. That's quite normal and should be within normal limits. You may notice some contour irregularities. The majority of these will settle over time. Occasionally they can be permanent. Larger areas of contour irregularities may need fat injection or other surgery to improve the appearance. Complications include hematoma, that is, bleeding underneath the skin. It is rare for this to require surgical intervention. It's usually manifest as severe bruising or swelling in the area. It may form a hard lump of tissue as the blood clot hardens, and then over several months will soften and disperse over time. You may require further surgery to deal with the outcome of this. Infection is unusual and will be in the region of 2 to 5% risk. It's usually treated with oral antibiotics and will usually be small areas around the incisions. Rarely it's cellulitis. A spreading infection could occur and may require admission for antibiotics under a drip. Skin changes can occur, particularly with more aggressive liposuction or liposuction close to the skin. This may result in blistering of the skin, pigmentary changes to the skin, or even skin loss. Skin loss may result in permanent scarring. By having a procedure performed under a general anaesthetic, there is a risk of clots on the legs. This may manifest as calf tenderness or even breathing difficulties a couple of weeks down the line. Rare risks of liposuction include perforation, that is, the cannula enters part of the body that shouldn't go. This may result, for example, in a collapsed lung. These are very rare events, but are possible and we're obliged to tell you about them. Fat embolism usually occurs when large amounts of liposuction have been performed. The fat is liquefied and forms droplets which get absorbed into the bloodstream. These can then get stuck in the lungs and cause breathing difficulties that may require readmission for breathing assistance. Large volumes of liposuction may require large volumes of local anaesthetic infiltration. This could reach toxic levels. Large volume liposuctions can result in fluid shifts in the body, requiring transfer to an intensive care unit. I would not normally agree to perform a large volume liposuction. Most common complications are aesthetic complications. You may feel the result is undercorrected or overcorrected. You may feel that there are unacceptable contour irregularities or asymmetries. You may simply be unhappy with a technically good result. It's really important for me to work out what your motivations and expectations are in order to ensure that I can meet those expectations and give you the result that you want.